recording for everybody else. All right, so we're going to go through this case study today, and like I said, I don't want to spend too much time beyond this, so hopefully we'll get through this and everything. If you haven't got a chance to kind of look through and read this, I don't know how big it is for you. I tried to make it as big as I can. Let me see if I can make it any bigger. Is that better? Can you see that?
Yeah, I can see that.
Okay.
I also have it on Blend too.
Yes, and it is up on Blend, so you can pull that up as well. But basically, without me reading the entire thing to you, Jordan is a high school student, just finished high school. And essentially, they're talking about the fact that he was going to college and that after a week after graduation, he started to feel ill. Okay, he didn't seem like he was feeling better. He was nauseous. He would throw up for no apparent reason. He thought he had a stomach virus or food poisoning, but when it persisted, he started having difficulty with his vision. So he realized it could be something more serious. So one particular afternoon, Jordan was feeling extremely tired and didn't want to get out of bed. And so his mother said, you know, I'm worried about you. And she took him to the hospital. They ran various tests to try to figure out what's going on, including a blood test for normal liver function, as well as a CT. So the first couple of questions are just, without going on, what do you think, or what do you hypothesize is wrong? Jordan. So what do we think could be some things?
I said he has a brain tumor because my grandmother had brain cancer, and those were the starting symptoms of it.
Which specifically symptoms do you think it would be?
Like, she had all of them, like the tiredness, the vomiting, the difficulty vision. Like, that's what I thought. Like, I don't know.
Okay. Leilani, any thoughts about that? Other things that you think it might be?
I'm not sure. I mean, brain tumor sounds spot on, I guess. I don't know.
Well, and my thing is like, I just also, as I was reading this, and I don't know if I switch tabs. Stop it. Go away. I don't want to write up there. Let me go back to my little mouse. I also, like, I started making some notes, and I just said, honestly, he's sick with something. You know what I mean? Like, and I said that it could be the flu. It could be, you know, when you are overly tired, you could potentially just even have trouble with vision that way. So, you know, it could just be some sort of overall sickness. And I went down, and as I was thinking about that, I looked at the next question, and it said, what do you need to know in order to support this hypothesis? And I said, personally, I want to know what the answers to the tests are.
Yeah, that's what I put.
You know, like, I want some more information. Okay, so this is pretty, like, basic in the beginning. Good so far, yes?
Yeah.
All right. So as we scroll down here then, now we start looking at Jordan's diagnosis. So they say his blood test came back negative, but the CT scan was inconclusive. And so they wanted to do an MRI. So Jordan had a feeling that something wasn't right when the technician had a concerned look on his face after the procedure. All I think here is, wow, somebody doesn't have good bedside manner. You don't make a concerned face as you're doing a test. But anyway, after a period of waiting, Dr. Kale called Jordan and his mother in to talk to them. Jordan, I'm sorry to tell you this, but you have a brain tumor. Okay, so Matthew, you're correct. Okay, so he said the tumor's on your occipital lobe, a part of the brain that plays a role in vision. That's why you're having trouble seeing. So they said they would need to perform surgery to remove and further categorize the tumor, and they were uncertain if there were additional tumors. Okay, so I have this other page pulled up. So this is the one it says to go to, the what is cancer portion, I think that's what it says to go to first.
Yeah.
Okay, what type of tumor could Jordan have, and explain your reasoning. So if you go down and look, it kind of goes through, and we've talked a little bit about this, which is why I kind of liked how this reaches back to some of the things we've talked about in the cancer cycle. and then putting it back in and talking about epigenetics as well. So you have two options, right? You have malignant tumors that can spread, invade into nearby tissues, or you can have malignant tumors, or I mean benign tumors, sorry, that don't spread or invade nearby tissues, but benign tumors can be large. So benign don't usually grow back, where malignant ones do. So if we pop over to this information, which type of tumor do you think Jordan has?
I see it as malignant tumor because the results are still unconclusive, which means that it wouldn't necessarily be a very large benign tumor, and most tumors in the brain spread pretty easily. From my personal experience, they do. So that's what I put.
Okay, so you said malignant. Leilani, what do you think?
I think it's also malignant just from like the reading and what it says.
So I know from like my own thoughts, it would be nice if it was benign, because benign would then mean potentially if we were able to remove it, it wouldn't grow back, because that's kind of the difference between the two. Benign being that it's not going to transfer easily and that it can be removed. The problem is it is typically larger, so then they might have to remove a larger portion of that occipital lobe, which could cause permanent blindness. And then a malignant tumor would be one that can spread and would, of course, be, I guess, rougher. So the last one, how do cancers form? This is kind of a hit back towards what we've talked about. If you go back and read in that as well, it does talk about it a little bit more between cancer cells and normal cells, talking about them growing out of control, that they're less specialized, and they can divide without stopping. Specifically, does anybody remember what typically it turns off or what it does?
Doesn't it turn on the oncogenes and turn off tumor suppressor genes?
Okay, so you remember that P53?
Yeah.
P53, and talking about the fact that it basically allows that to continue, and allows it to kind of break through the checkpoints. And then if you think back to mitosis, we talked about adding on those telomeres onto the end. And so that is going to happen a lot quicker because it's trying to protect that information in the cancer cell, because the cancer cell wants to keep on living. All right. So as we keep going down, the medical team taking care of Jordan ran further tests. They took a biopsy. Okay, so supports that Jordan has stage 4 glioblastoma multiforme and aggressive cancer of the brain. Glioblastomas are cancers involving the astrocytes, which we didn't talk about the nervous system in this class because they kind of took the immune system out for some. But it does explain here that it's a supporting cell in the nervous tissue. Okay, they often spread quickly to other parts of the brain, and it's hard for surgeons to be able to fully remove them. The doctors determined they would perform surgery in an attempt to remove the tumor. This was tricky as it was associated with the areas in his brain that controlled vision. Okay, so surgery removed some of the cancer cells, but not all of them, and it appeared that some had spread. So we'd also need to go undergo chemotherapy as well as radiotherapy and see how it would respond. He was also put on temozolomide. I don't know what that is necessarily, so excuse my pronunciation. But that drug damages actively dividing cells. It works in most, but not all patients with glioblastomas. An individual's epigenetic markers on a particular gene, on the MGMT gene, are associated with the effectiveness of this. Epigenetic tags enable genes to be turned on and off. The flow of genetic information is typically from DNA to RNA to protein. When genes are turned off, they do not express their encoded proteins. So cysteine methylation of DNA and the deacetylation of histones are two ways that genes are switched. off. So how do cancer therapies work? And so they have this little thing over here. How does chemotherapy work? So I'll give you a second to kind of look over that portion. Hey, Jasmine. Nice to see you.
I'm here. I didn't forget, but then I kind of did, and I was like, crap, I'm here now.
It's okay. We're recording right now, just so you know.
Okay.
All right. So if we pop back over here, so it's asking, how do cancer chemotherapies work? So essentially, they aim to eliminate all the cancer cells in the body and make it go away completely for curative chemotherapy. And it talks about all the different chemotherapies. But I feel like overall, we're trying to fight the cancer cells using chemotherapy. And again, most of this case study is almost straightforward, especially those of you that have experience with things. Okay, so this part, so this goes into this on and off genes that we talked about. So the promoter region of DNA is where the enzyme RNA polymerase attaches to start transcription. Figure 1 shows examples of unmethylated and methylated promoters. What effects do you hypothesize that methylation can have on the expression of a gene? So if you look, this is the probability of overall survival rate and the number of months. So if you have an unmethylized promoter versus a methylized promoter, which one has a higher percentage chance of survival?
A methylated promoter.
Okay, so if you know anything about methylation on like nerve cells, we talk about them being like myelinated. It's talking about the thickness around them. And so like it actually sends the signal faster. So I would think that that would make sense when we're talking about that promoter region there. So it says examine figure 1 to describe how methylation of MGMT promoter relates to the probability of survivors. We just kind of talked about that a little bit. Ignoring whether or not the MGMT promoter is methylated or unmethylated, do these cancer patients generally have a good prognosis?
No.
Negative. Okay. Propose at least 2 other ways that doctors could treat Jordan's cancer regardless of whether or not it is methylated or unmethylated. So you can kind of pop back over here. I believe it talks a little bit about other options. I thought it did. No, maybe it doesn't. All right, so besides chemotherapy, what do we got?
Immunotherapy.
Isn't it like radiation?
Okay, so we've got immunotherapy. That might be spelled wrong. I'm sorry. We've got radiation. Anything else?
Natural ways of treating cancer.
Sure. I'm going to put naturalistic. They're in there.
Just some people just pray. That's like
Right. It's, you know what I mean? What do I want to put for that? How about I put
Supportive care.
approach? How's that? Okay. Good. Okay, so there's lots of different things, you know what I mean, that could potentially happen or be done. All right. So not all individuals with a glioblastoma respond the same to similar treatments. This can at times be attributed to differences in their genetic backgrounds. Okay, so it says recall, don't worry about the pre-class videos, we didn't watch that. But we know that radiation can damage DNA. We kind of talked about that, for that including specific proteins. So the MGMT gene encodes a protein that is involved in repair. So when these happen to be methylated, it is turned off and does not repair the DNA in the cancer cells. As a consequence, the cancer cells undergo apoptosis, and so the drug can be more successful in killing the cancer cells. When it's unmethylated, the gene is turned on and the protein does repair the DNA of cancer cells. Okay, so the treatment is ineffective. So when we think about what role does MGMT play in cancer cell regulation, what is it going to do?
I said it could
Well-
proteins are involved in DNA.
Repeat that again. You kind of went in and out for me.
It encodes for proteins that are involved in DNA repair.
Okay. All right. Is it more favorable for Jordan to have methylated or unmethylated MGMT promoters?
Is methylated where it's like, what's methylated again?
Well, we go back up here and look at the thing. Which one has the better rate?
The
Methylated.
methylated one?
Yep. So essentially, you would want him to have the methylated because it's a better life expectancy.
Yeah, there's a higher chance of like being well.
Okay, and then let's see if we look down at the last one, examine this figure. Okay, this is the best hypothetical treatment if his promoter is unmethylated. So which one would you want to do if he had unmethylated?
Unmethylated radiotherapy with the temozolomide.
Yep. Okay, see how that's kind of there. I mean, the odds are much lower, but still better. Okay, so relate MGMT methylation to what you know about the central dogma, flow of genetic information, and how genes are expressed. Toughy.
So the MGMT is transcribed in codes for a protein that works in DNA repair, but when the site of the genome protein doesn't repair the damaged DNA in cancer cells.
Right. Okay. If Jordan had an identical twin, was the likelihood that his brother would also develop this cancer?
Is it? I don't think it's that likely, but maybe it is because like there's like genes, but don't they have to like be like a mess up for cause the cancer? So like it'd be less likely that he'd have cancer.
Right. And the thing is that, there's still mutations. That mutation still has to happen. Sometimes with specific genes, it's more likely, but it's not necessarily. Okay. Devise a therapy that could potentially circumvent resistance to temozolomide. I'd have to go back up and look at what that does because I don't remember. This drug damages actively dividing cells. Oh, so I would guess then that if circumvent resistance to this. So if they could do something, maybe it's the amount that they give him this, or they add something to it so that cells don't become resistant to this and it can still damage those cells that are actively dividing, aka specifically those cancer cells that are going in at a rate. Okay?
Mm-hmm.
So look, they gave you this nice ending. That doesn't happen all the time. Look at that. Jordan was okay. He's smiling, gazing out of his dorm room window. Okay, so again, it doesn't have, the reason I wanted to do this one is because sometimes, when they link things together, it doesn't necessarily seem like they're doing something specific in that area. They want you to kind of put everything together, which is why I wanted to kind of look at this particular case study because it talked about quite a few units and quite together, but I do think that you're at the point that you should be able to use this to answer it fairly easily. So